On the 12th of September 2013, MWT IHM, in conjunction with IHNA Australia, conducted a seminar on the Indo-Australian healthcare system at Kochi, Kerala. The seminar was held to explore and gain a deeper understanding of healthcare perspectives and globally relevant reforms in the world of health education. The seminar was very well attended with over 200 participants comprising delegates from Australia and healthcare professionals from Kerala and across the country. It was a grand success and was much acclaimed by all the delegates who attended the day-long event held at the International Hotel, MG Road, Ernakulam, Kerala. The MWT Institute of Health and Management was set up in the year 2011 with its head office in Kochi, India. In a very short time, it has been recognized as one of India's fastest growing providers of accredited health and nursing education, both at national and international levels. From intensive clinical, practical and technical training in nursing and healthcare to extensive professional development, MWT IHM provides comprehensive educational programs which are driven by excellence and foster professional growth. MWT IHM graduates make a significant contribution to a growing team of competent, qualified, dedicated and caring health professionals worldwide. The Institute of Health and Nursing Australia, IHNA, is one of Australia's leading providers of comprehensive health and nursing education at several levels. IHNA offers quality, workforce-focused education programs for its students in the health and nursing sectors. The rigorous curriculum set by IHNA for its students ensures that they are on the cutting edge of medical knowledge and technology worldwide. IHNA presently offers programs from campuses in Melbourne, Perth and its new campus in Sydney, and also offers an extensive library on online programs. A vast network of affiliates worldwide helps IHNA graduates maximize their professional growth and career prospects.
warmly welcome Dr. Jacob, orthopedic surgeon at the Little Flower Hospital, who is also one among the board of directors of the MWT Group, to come up on the stage and to address the welcome speech.
MWT Institute of Health and Management commenced its operation in 2011 and is one of the India's fastest growing group providing accredited health education both at the national and the international levels. In today's challenging healthcare scenario, there is a very real need for intensive clinical, practical and technical training in healthcare to extensive professional development. We at MWT provides comprehensive educational program curriculum which are designed to support excellence in healthcare and foster professional growth and teamwork. We believe that nursing is an integral part of healthcare delivery system and it works collaboratively with other allied health professionals for prevention of disease, in promotion, restoration and maintenance of optimum health for individual and families both in the hospital and in the community. We believe that each individual is diverse, dynamic, complex, holistic being with rights, responsibilities and inherent values, and a nurse must be trained in such a way that he or she should be able to assess, prioritize, plan, deliver and evaluate nursing care based on the individual requirement. We promote all-round development of students and we are committed to deliver nurses with concern and empathic attitude towards the ever-changing demand of the society.
Ladies and gentlemen, let us warmly welcome our CEO, Mr. Ernakulam, to give you all a wide perspective of this event today.
I'm very happy to be here today with delegates from many hospitals in Australia. They all work with our institute in different aspects. They are supporting us in clinical placements for our students, undertaking programs in our college, as well as they have recruited quite a lot of nurses in the past and also would like to recruit more in the future. And there is a lot of changes in the last few months, but we hoping that things will move on and they should be able to look into recruiting more nurses in the future. And I'm very happy to be here today. And of course, it's my hometown in Kerala, and it's our God's own country, and we are proud of our place. And in reality, there is a lot of things we can be proud of. We have the best literacy in India, which everybody knows, and we have put a lot of efforts. And in Sindhuban University, they have a program, postgraduate qualification in sustainability, and one chapter is about Kerala. Maybe you don't know about it, but it's really, I have seen that, and they're talking about the per person carbon emission in Kerala is very low compared to the world average. It's mainly because our electricity is produced from hydroelectric projects, and we don't have a lot of factories producing smoke here in Kerala. But in Kerala, actually, we advanced a lot more into IT sector, and also you can see that our health system actually grown a lot. and many of our health professionals are working across the globe, provide that kind of same quality training in Kerala. And here we also offer ACLS and BLS training, and we working in hospitals now, going to the hospitals to deliver programs. And Kerala hospitals not really embracing those kind of initiatives, but I think slowly or steadily they will be able to adopt more training needs for the nurses and other healthcare workers, because it is a need, and patient care is very important, and nurses play a very important role in that part. So us IHNA and IHM joining together today, and we offering this conference here by bringing a lot of knowledge from the hospitals, all the staff working in the hospital coming to talk to us directly and their expectations, so that we can build our education system better than what it is today. And our nurses can prepare much better for working in Australia or elsewhere in the world. And I think we work together to achieve that. And I can also tell you that when you're going to Australia, you have to prepare all these things. You have to do postgraduate qualifications, you have to do professional developments, you have to do a lot of learning to be successful in Australian healthcare system or working as a nurse in Australia.
Our chief guest, Dr. Padma Kumar, who is the Chief Medical Director of Sunrise Hospital.
Our hospital, I just wanted to show it as a model so that you can easily understand how healthcare system is taken care in this part of the world. We have our mission to bring the smile of good health on every face, and we put experience, expertise and care as our captions in all our ventures, and our USP is laparoscopic surgery, the keyhole surgery to take care of patients. We have our main hospital in Kerala. It's in Cochin itself, which is under NABH accreditation process, which some of you had the opportunity to visit. We have departments from accident emergency to various departments, cardiology, cardiothoracic surgery, all advanced specialties, the diabetology, developmental pediatrics, which is not usually there in other hospitals, ENT, endocrinology, lab surgeries, learning enhancement centers, then maxillofacial, neuro, all these departments, obesity and diabetic surgery department as well, and pulmonology, radiology, shoulder and upper limb surgery as a specialty itself is there in our hospital. We have other operations in Kerala. One is in nearby Palarivattam, another one is North Kerala. It's Kanjangad, then mid part of Kerala, it's Changarangulam, 2 hospitals, and Alapi hospital is under construction. So we are into 6th hospital in Kerala itself.
I request Ms. Annie Santana, a chief guest, Regional Director, Education State Government Victoria, Australia, to come upon stage to launch the IHM Professional Development Course ceremony.
This commendable initiative will not only bring the Australian and Indian health professionals closer together, but will also enhance the skills of this very important profession. So congratulations, Institute of Nursing Health Australia and MWT Institute of Health and Management on this important initiative. We believe that these relationships will further strengthen the many ties that we are trying to build between government, industry, and institutions with India. India is also an important strategic partner with a notable influence in this region. So I guess it would be fair to say that the relationship between India and Australia is only deepening and widening. Of course, there is a recognition that we could do more, and an effort in that direction is the Victorian government strategy, which was launched earlier this year, called Victoria and India, from engagement to partnership. The strategy in many ways was a framework and an implementation plan to strengthen the economic engagement between Victoria and India. And I think economic engagement is underpinned by the relationships we build. And that could only happen when we can enhance understanding of each other, of each other's culture, history, and people. This is one of the reasons why programs like today are so important, that create a space to nurture and build these relationships. And our priorities through this strategy is exactly that. We want to enable the understanding by supporting education programs that encourage exchange. There needs to be more events like today that will make it happen. Of course, our priority is also to build trade and investment links. We do that by supporting Indian companies who are looking at growth opportunities in Victoria and Australia. We also recognize the role that institutes like IHNA do play in building the academic and cultural ties. These contribute to a stronger and productive engagement. I believe for many of you here is probably your first time to India. India is a journey of discovery, a meeting of minds, a meeting of cultures, a meeting of interest, opportunities, and for some of you it could be all quite overwhelming.
Ernakulam has been the operations director of IHM since the year 2011. She is a registered nurse by profession and has vast knowledge in theoretical as well as clinical nursing. Her experience in nursing in Australia helps IHM at the moment to implement the highest standards of training in their educational courses.
Respected delegates, staffs and students who all gathered here, and I am extremely happy to be here on behalf of MWT IHM on the auspicious occasion to give you an insight on Indian culture. As we all know, India is a vibrant country which is at the crossroad of different culture, religions, ethnic and languages. And the geography of the Indian subcontinent takes you through snow-dusted mountains to sun-washed beaches and colorful bazaars to tranquil temples and cosmopolitan commercial hubs to tiny villages where electricity is still a dream. And today's world, India represents unity in diversity. With each of its 29 states housing citizens who follow completely different festivals. We can see, if you search about Indian culture, you can see that different places, even within Kerala, we celebrate different festivals. It's not that the only festival which we celebrate together is Onam. Other than that, different regions, they celebrate different festivals and cultural traditions. So individual religions have their different cultural traditions. Even in the healthcare system also they have different different traditions. Language, as we know, around Indian government is recognized around 15 languages in India. So when we come across or when we go across India, we will be meeting different people speaking in different languages. Still, we migrate to each states and we will be employed in different states. We are surviving because Hindi is a common language, and also we use English as a common language. Everyone speak English, and Kerala is a fully literacy state. Of course, I know that all Keralites can, at least they can communicate with people. To manage, they can communicate in English. That is the specialty of Kerala, God's own country. What we are lacking is little bit of assertiveness. That's what we lack when we come to Australia. Our nurses, of course, they are very good and they know everything, but what we are lacking is little bit of assertiveness we are lacking. So they will not come forward and tell something. It's little bit because of that upbringing is like that. That's why they do that. I just want to mention that because you are coming across with a lot of Indian people. It will be better for you to deal with them once you come across all of them. India has variety of medicines and allopathic treatment is one among them. We have Unani, Ayurvedic, homeopathic, all kind of treatments are available here. So people depends on their religion and beliefs, they go to different treatments. You all might have seen that Ayurvedic treatment is very popular in India, especially in Kerala. And 5,000 years back, this Ayurvedic treatment started, and people go for massaging and some Ayurvedic medicines they would like to prefer to have when they get ill or sick. Next is healthcare professionals. You all might come across with a lot of healthcare professionals. Previously, much people were not coming for nursing and other nursing, but now a lot of people are coming for nursing, and everyone is doing graduations or masters or PhD. Everyone wants to upgrade themselves. They don't want to stay like just as a staff nurse. They do many courses and they want to come for they want to work different levels, and they are performing all the especially from Kerala. We have a lot of health professionals in and around the world, and they all are doing very good, and they are performing well. They are in good positions in different levels in Middle East as well as European countries, Australia, USA, everywhere. People are doing good in different levels. They are working. Only the problem is, as I said in the beginning, they have little bit of lacking of assertiveness, because our upbringing is like that. That is why we are lacking of little bit of assertiveness. Otherwise, we are very good, and they are health professionals, because we brought up in different culture and different. We are facing different people, different ways of living people. Anywhere we go, we can accommodate easily, and we can adjust anywhere in any countries or any place where we go, because of the things which we come across here, different culture, different religion, different language, everything we are facing. So we can easily accommodate anywhere in the world. That is the specialty of Indian nurses.
Jacqueline Verdon, she is with the Northeast Health Regulator, Victoria, Australia. Ms. Jacqueline is an interprofessional clinical educator, education and research, Northeast Health Regulator. She also leads junior medical officers of the Nursing and Allied Health Undergraduate Clinical Placement Coordinator, ADWS, and she also holds a bachelor degree on social work, BSW.
We've been asked to come today. Thank you very much for the invitation and the support to come and speak to you about our insights into living and working in Australia. The objectives of the presentation and what we've been asked to speak on are the Australian culture and difficulties that people might face in coming to Australia, and some tips about how best you might manage our uniqueness that is Australia. Australia's population is 23 million people, which is a shadow of what India's is. Australia is the 6th largest country in the world, and it occupies an entire continent of some 7.6 million square kilometres. It has the third largest world's ocean territory, and spans 3 oceans. That covers around 12 million square kilometres. Vegetation covers the majority of Australia, and we have an amazing ecosystem with unique flora and fauna that can't be found anywhere else in the world, including rainforests, rock formations, beautiful beaches, but also our exotic flora and fauna cannot be found anywhere, as I said. So platypus, koala, kangaroo. We are the only Australians live within 100 kilometres of our coasts. In 1945, Australia's population was around 7 million people, and these were mainly Anglo-Celtic. Since then, more than 6.5 million migrants, including 675,000 refugees, have settled in Australia, significantly broadening our social and cultural profile. Australian culture is as broad and varied as the country's landscape. Australia is multicultural and multiracial, and this is reflected in the country's food, lifestyle, and cultural practices and experience. Over 200 different languages and dialects are spoken in Australia, including 45 Indigenous languages. Australia has a strong culture and identity characterised by being down-to-earth, sense of mateship, honesty, sports and multiculturalism, based on research organised by the Australian Day Council of New South Wales in 2008. In 2009, about 2.6% of the estimated resident population in Australia comprised of those born overseas. Many of the people who come to Australia since 1945 were motivated by commitment to family or a desire to escape poverty, war or persecution. The first waves of migrants and refugees were mostly from Europe, and subsequent waves came from the Asia-Pacific regions, Middle East and Africa. Migrants have enriched almost every aspect of the Australian life, from business to the art, formal and broadly egalitarian society. We were talking yesterday as a group about the size of it as there are in some other countries. It also means that with hard work and commitment, people without a high level of connection or influence, influential patrons, can realise their ambitions. All people are equal under the law in Australia, and all Australians have the right to be respected and treated in a fair manner. A typical Australia. Given the diverse nature of today's Australia, some people question whether there's a typical Australian. That is, of course, no shortage of popular stereotypes, some of which contradict each other. However, languages other than English, are also valued. In fact, more than 15% of Australians speak languages other than English at home. While English is Australia's national language, there are certain words and expressions that have become regarded as uniquely Australian. Through common usage, some of them might seem strange to non-Australians. The use of these colloquial and slang words, often coupled with the Australian sense of humour that is characterised by irony and irreverence, can sometimes cause confusion for international visitors.
I also request Katie Hicks to be on stage. Thank you very much.
The sporting culture, they love their sport, both playing and watching it. A recent national survey showed that more than 11 million Australians aged 15 or over participated at least once a week in physical activity for exercise, recreation and sport, which is a participation rate of almost 70%. Key facts about Australia. There are more than 6.5 million migrants that have settled in Australia since 1945. English is the national language, but there are other languages which are valued. Australia is predominantly Christian, but people are free to practice any religion they choose. Australia has one of the most diverse cuisines in the world, but no national dish. We do have things like Vegemite, Tim Tams, Lamingtons that some of you may have heard of. Gian and Chenoweth in 2007 observed that communication in a language different from one's own is not a skill that is mastered through study alone. Practice, practice, practice to master a skill. One custom in Australia is Australia Day, which for us is a celebration of diversity and tolerance in Australian society, embracing all ethnic backgrounds, racial differences and political viewpoints. Some more tips. Make sure you get to know the people in your new environment. Respectfully ask questions, read newspapers and attend a variety of festivals and events. Most importantly, maintain a sense of humour. Don't be too hard on yourself if you make a cultural mistake or don't know what to do in a social situation. I've made plenty of them since I've been here in India already. Laugh at yourself and others will laugh with you. Most individuals will admire your tenacity and effort to understand their ways, especially if you are devoid of judgment and cultural comparisons that subtly and perhaps unconsciously convey a veil of superiority. Try to achieve a sense of stability in your life. Establishing a routine will give you a feeling of safety. When one experiences culture shock, it is natural to withdraw to the comfort of what is familiar. In the picture there, we just have some iron students, which this photo was taken at our hospital just recently. It is always good to keep in touch with family and friends back home. However, just be mindful that spending too much time communicating with them can sometimes exacerbate homesickness and delay the acculturation process.
Mini, the Associate Professor of Anantapuri Medical College, Trivandrum, Kerala. She has had 12 years of teaching experience in colleges under the University of Kerala and institutions under Kerala Nurses and Midwives Council, Thiruvananthapuram, Kerala. Mini will be talking on Indian public healthcare system.
We have the major health problems faced by Indians are mainly communicable disease problem, non-communicable disease problem, nutritional problems, environmental sanitation problems. And soon in 2025, we will become the first country in the world having the most populous population. So we have the population problems also. We were having very limited resources here. So the major resources here are manpower, material, money and minutes. So with these resources, we can have a quick glance on the model of the health delivery system which is followed here. We have input like health status or health problems and the various resources. And with this input, we are having the healthcare services, like we are mainly giving promotive, preventive, curative and restorative services to the public. And we are rendering all these services through systems like public, private, voluntary and indigenous system that we will see in detail later. And with this, all these healthcare services and healthcare systems, we have to achieve that output of change in health status, improvement in the health status. This is a model of the healthcare delivery, healthcare system. Before going into the actual system of healthcare delivery system, just have a look on the administration, how this healthcare delivery system is managed here, what is the administration of healthcare management system in India. So we have 3 different levels of administration in India. At the central level, we have Union Ministry of Health and Family Welfare, Directorate General of Health Services, Central Council of Health. These 3 are at the central level, and we have 28 states. So at the state level, we have 2 different type of administration, like at the state level, State Ministry of Health and State Health Directorate. And at the district level, we have so many subdivisions of the districts, and they are different administration. They are taluk level, we have community development blocks, we have municipalities and corporations, and of course in the grassroots level, we have villages and panchayat. These are how the public health administration is there. So in India, we have 617 districts, 6,345 blocks, 62,000, 6,23,706 villages, 4,045 community health centers, and so many primary health centers. So these centers, our main first contact care is a primary health care. So in the villages, we are mainly rendering the primary health care through the village health guides. And this village health guides are mainly taking care of all the medical issues, medical health problems of the individuals.
Usha Ravindra Nair is a principal at CMC College of Nursing, Kalmasheri, qualified in MSc Nursing and MA Psychology. She has had 36 years of experience as a staff nurse, as an instructor, as an infection control nurse, as a lecturer, and as a principal in India and the Middle East.
Adding to the growing need for healthcare is the increasing urbanization, aging population, and great access to new medical technologies. Though India has sophisticated healthcare capabilities, they are often available only to a selected few. With investment in healthcare a growing priority among these economies, both public and private providers must consider the best methods of delivery if the demands of our population are to be met. 75% of India does not have any form of health cover, cost of healthcare and health insurance. In India, healthcare and health insurance have seen cost soaring. Hospitals, from the smaller hospital, bigger hospitals are always referred as tertiary hospitals.
Doreen is a nurse manager, career development, recruitment and retention, Hunter New England Health. Doreen is a senior nurse manager who is responsible for career development, recruitment and retention for the nursing and midwifery workforce and the area coordination of the clinical placement process in Hunter New England's local health district.
Australia has the privilege of not only being unique in its geographical shape, as if you just reflect on this slide and look from a universal perspective where Australia actually sits in the universe, but it also has a universal presence in terms of healthcare. Its healthcare system has emerged as a leader in the public healthcare sector, and it has a system that has many different facets. The ever-changing needs of the Australian population, which is now a multinational cultural population, influence government decisions, and certainly it leads to a great deal of thought and innovative approaches to the provision of healthcare services. But some interesting statistics that you might like to consider in terms of the demography of Australia reflected in this slide. As already has been said by Jackie, the Australian population is 23.1 million, and 80% of the population live in urbanised areas, predominantly along the coastal regions of Australia, and they reside in temperate climates. The exception to this, of course, is the people that reside in regional and rural areas, and the climates in which they live range from hot and dry to hot and cold. Some other interesting things that you might like to know is that the life expectancy in Australia is 81.9 years, which is a significant increase with the progression of healthcare. The other interesting facet that impinges significantly on healthcare in Australia is that 13% of the population is over the age of 65 years. We also have 98% of our population speak English, and within that, 400 different languages are spoken by 18% of the population. So it certainly demonstrates the multicultural nature of the environment in Australia. Australia has 6 states and 2 territories, and it is the 6th largest continent in the world. Most of the population, as I've said, reside in coastal areas of the country, but the density of population obviously is in the capital cities, which are reflected by the 4.4 million participants that live in Sydney, 4 million in Melbourne, 2.1 in Brisbane, 1.7 million in Perth, and Adelaide has 1.2 million. So if you're comparing our major urbanised capital cities with Cochin, we certainly do have smaller populations. However, we also have the unique position of the multicultural flavour to our population. Our ageing population requires extended care strategies, and it's interesting to note that in India most of the people in the elderly population are cared for by relatives. There still is a high proportion of people in Australia that are cared by family members. However, there is an increase in community care packages for the elderly as an innovation in healthcare. The significant thing to consider is that healthcare costs are forecast to almost double by 2015, which is a significant cost issue. When we have a look at the Australian health landscape, there are some quite significant influences that need to be taken into consideration for any policymakers or governmental bodies or even health services to consider when they're developing up and designing what the strategic plan for health service delivery is to look like. Obviously, our ageing population is a significant issue. We have to work within that, and we have to think about the diversity of the geographies across the nation. And as already displayed in the first presentation by Jackie, there's a significant difference between the metropolitan requirements and the regional and rural environments across Australia. We need to think about the federal and state government, and I'll mention that a little bit further in a few moments, but it's quite a complex undertaking. We also need to think about the fact that we have workforce shortages. across the country, we are starting to see the benefit of some work that was put in by Health Workforce Australia to reskill and retrain people to help meet the health workforce shortage needs. And from our perspective, and particularly from a workforce perspective, the introduction of the international nurse into our workforce population has been a tremendous innovation and is very supportive in sustainability for the long term for our workforce. Provides services such as general practice and specialist services, whether that be diagnostic imaging or pathology services. The Pharmaceutical Benefits Scheme is a fairly unique opportunity to explore this. It is a significant contributor to the healthcare system, as most prescribed pharmaceuticals dispensed by the private sector pharmacies are directly subsidised by the Australian government through the PBS scheme. And what this does for us as citizens, it gives us affordable access to a wide range of necessary and cost-effective prescription medications. Otherwise, they could be cost prohibitive for some people. It protects individuals and families from large overall expenses for PBS-listed medications by providing safety nets for people. General practice, a very big growth area in healthcare provision in Australia. The increase in resources put into general practice is to try and mitigate some of the tension and stress that's placed on public health services with people arriving at emergency departments for things that could be treated by general practitioner services. And to actually make this more efficient, the government has supported computerisation of general practices, which provides significant benefit to patient care. You could well imagine if you were a client coming in and you weren't able to see a local general practitioner, if the medical officer that you could actually see could log in and have your records there instantaneously, as well as what your medications you're on, makes an enormous difference for medical practitioners in their diagnostic practice. The introduction and now widespread use of practice nurses has increased the productivity of the average GP, which means that the GPs can now focus on the more critical issues of patient care and leave the nursing care to their practice nurses.
Susan Brazil, she is a nurse manager, has had 40 years of experience in nursing in both senior clinical and managerial roles within Hunter New England Health as a clinical nurse consultant, nurse unit manager, and in her present position of nurse manager for nursing and midwifery services in Hunter New England Health NSW Australia.
One of the major components of the Australian healthcare system is the National Registration and Accreditation Scheme, which governs health professionals' education, their practice and their continuing professional development. The Council of the Australian Governments, which is our COAG, decided in 2008 to establish a single national registration and accreditation system within the Australian healthcare setting. In 2010, the following professionals became nationally regulated by the corresponding national boards. They were medical practitioners, nurses, midwives, chiroprators, dental practitioners, optometrists, osteopaths, pharmacists, physiotherapists, podiatrists and psychologists. In July 2012, 4 additional professions were added to the APRA registration. They were the Aboriginal and Torres Strait Islander health professionals, the Chinese medicine practitioners, medical radiation practitioners, and they've continued on our register now. Prior to the Australian Health Professionals Regulation Authority being established, each state and territory had their own nurses and midwives registration boards. And this caused a lot of issues for nurses who wished to come to Australia and register or train in other states. They needed to acquire registration in each state to work. Since the establishment of the APRA registration system, we now only have to register once and we can work wherever we wish to work across Australia. And we pride ourselves, I'm proud pride ourselves on the following strengths. We provide high quality, safe, holistic, patient-centred care, and we have skilled, hard-working and valued staff.
Mrs. Urmila D.S. She is the Associate Professor, College of Nursing, Anantapuri Hospitals and Research Institute, Trivandrum, Kerala. She will be presenting the topic Clinical Education in India.
Clinical education or nursing education is a practice of discipline, and the students will learn the subject matter by doing things and practice skills. To create the subject matter learned in ideal situation, clinical teaching is organized. And the main approach in India we use in clinical teaching, that is client family centered approach, that is individualized care is given by the students to the patient, and the family members will be educated about the care of the patients. Clinical teaching is a method that is given in the clinicals that is entirely different as compared to the teaching in other settings, because here the students are dealing with the real patient situation. We can classify the clinical teaching methods, that is bedside clinic, we use bedside clinics, nursing rounds, conferences, nursing care plan, nursing case studies, role plays, simulations, mock drills, health talks, brainstorming, demonstrations, process recording, ward teachings, assignments, problem solving, observations, field trips in clinical teaching methods. First is bedside clinic. Bedside clinic is conducted in the presence of patient. It can be medical nursing or combined. Sometimes the doctors will lead the bedside clinics. During that, the physician will be explaining about the condition to a group of students. Sometimes the clinical instructor will be leading the bedside clinic, and she will teach about the patient condition to the students. That is, prior information is given for the students. Patient assignment means a particular patient is assigned for a particular student. Work assignment means a particular work will be assigned. For example, for the vital signs of all the patient in a ward should be checked by a student. Functional assignment means some specific function will be given to that student. For example, checking of inventories daily in the area. Team assignment means organizing of any field trip, like such assignment will be given so that the student will be able to organize all type of assignments after she finishes her course. Process recording, another method, that is an exact written report of the conversation between the nurse and the patient during the time they're together, and record of patient's feeling about what was going on at that time, and as far as possible how the patient said and what he did. Usually we use process recording for psychiatric patients.
Miss Megan White, Workforce Planning Manager. Miss Megan, Health Scope Clinical Placement Manager and Rehabilitation Project Manager. Since 2012, Megan has been involved in company-wide rehabilitation projects, including the implementation of iPad application across all the Health Scope rehabilitation hospitals.
I'm here to talk about private healthcare in Australia. We have had some information given to you on both about the private system. But just to expand on that, we have private health insurance, not unlike your system here, and not-for-profit organisations and government institutions. Individuals can take out private health insurance to cover out-of-pocket expense costs, where there's a plan that covers just selected service to a full coverage plan. Again, very similar to yours, and many funds to choose from. I think in Australia the average cost for a family would be about $2,000 to $3,000 a year, Australian dollars. So it's not a cheap thing to do. People can also elect to self-insure themselves, so pay for their hospital visit, and that is, so their bed day would be approximately, and I hope I get this right for you, 36,500 rupiah per day, which is $650 a day in Australian. And on top of that, you have to pay for your doctors and anaesthetist charges, medication, everything else. So it's not a cheap exercise in Australia to do it that way, but people do it. And just to let you know, the average wage for a registered nurse per hour for about a grade 5, we think is about 1,920 rupiah. So that's just to give you an indication of the pay rate. health system in Australia. It's available for everyone who wish to cover the costs of becoming a private patient. Being a private patient provides members with the following benefits. It gives you the option to select your specialist and go to a hospital maybe near your home. Is that better? We have shorter waiting times, so if you need to get your cholecystectomy done and you might have to wait up to 6 weeks plus in the public sector. If it's not urgent, you can probably get it done in the next week in a private system. You have more control over, as I said, when and where to be treated. It takes the strain off the public system and frees up the government funds. Having said that, we now have a new government and we believe that will even improve even more. At the moment, about 40% of private patients are treated in the public system, which seems stupid when we've got lots of beds out there that we could treat them. Healthscope leads the way in the provision of quality... Healthscope leads the way in the provision of quality and performance-related information with the launch of My Healthscope in November 2011. This website allows members of the public access to see clinically significant information regarding our hospitals as well as information on our awards and accomplishments. We were the first private hospital to provide this data, and from each of its hospitals on the My Healthscope website. So every hospital has all their benchmarking data available. So what we do is look at the Australia's average in infection control and compare it with our hospitals. So we are very happy to say our average infection rate is much lower than the Australian average, and that's supported in a lot of areas.
Ms. Deb, Director of Nursing, John Faulkner Private Hospital. Ms. Deb has worked in the health services industry for 35 years in a range of management and leadership roles.
For the opportunity in presenting today, it is indeed an honour and privilege to be here. I thought I'd talk today to you about the hospital where I'm Director of Nursing, John Faulkner Private Hospital. We're 147-bed major surgical, medical and emergency hospital, and we're located in the northwestern suburbs of Melbourne. We're probably about 15-minute drive from the central business district. Our community has a high percentage of non-English speaking residents, and we have lots of nationalities and religions, Italians, Greek, Turkish, Chinese, Vietnamese, so it's very diverse. 560 staff members, and they all reflect our cultural diversity of Melbourne and our patient groups. So a little bit about our hospital, 147 beds, 115 overnight, 22 day case beds, 10 ED beds, plus we have a 20-chair day chemo unit, 10-bed post-operative recovery unit and a 10-bed endoscopy recovery unit, and we also offer a hospital in the home service. So when patients are technologies, we commenced cranial surgery in August 2013, and we're the first hospital in the Asia Pacific region to use the new Brain Lab KIC navigation system to perform craniotomy surgery. This system uses light-emitting diodes to co-register points on the head and track surgical instruments, enables surgeons to keep skull openings very small and minimise damage. We have a very strong focus on quality, and we completed a study last year over 4 months on our 31-bed surgical unit. This study compared the sensitivity of 2 renowned track and trigger systems, the Australian single parameter 2-tier track and trigger system with the UK's National Early Warning Score system.
Ms. Sri Devi Balachandran, Clinical Instructor, qualified in MSc Nursing, specialised in Cardiothoracic Nursing, SNDT's Women's University, Mumbai. Also MA Sociology, SNDT Women's University, Mumbai, and a postgraduate diploma in Medical Law and Ethics, National Law School, Bangalore.
Life of a nurse in India, it's a topic that's hard to talk about. I could just start humbly by telling about myself as a story. because I have over 30 years of experience in nursing, from staff nurse to director of nursing. So just a brief to tell you this. This is a little hard on the slide, just to say that nurses provide care, compassion without a prescription from the doctor. This is our job. There are not many things in India that you can talk in terms of scientifically. There's no studies. There are 3 studies that I searched in the literature. Business administration students have tried to see how do nurses function in India, what is their job satisfaction level, what is their lifestyle, what is their work life, etc. But nobody has really studied scientifically a life of a nurse in India. So just to give, before I brief on some of these things, I just want to tell that we understand that even in India or in Australia, wherever it is, work and family, life satisfaction and job satisfaction are all interrelated to our profession. So it is harder in India because if you look at the culture and the demands on a woman, because in this country, it's very hard. We live in a male-dominated society, typically male-dominated society, nothing which is egalitarian like you spoke about. And that means the woman looks after, she has a second shift to look after her parents as well as her children. As usual, many of us have to do long night shifts in India. Sometimes it's 7 nights, 8 nights. There are people who tell us they've done 12 nights continuously, though it may be 8 hours. And she was providing cold sponges to a patient who had fever. She couldn't somehow control herself and her facial expression changed. The patient asked her, "Sister, what happened?" Sister is how they refer to nurses in India. So what happened to you? And she didn't know what to say. This patient had fevers and she couldn't control herself, and she was thinking in her mind, I have a child who's having fever at 39 degrees at home, and here I am sponging a patient who's got fever. I'm sure many of us relate ourselves to lives like this as nurses, especially when we do different kinds of shifts. So this kind of story is not uncommon to anybody in any place, but quite common to us in a life in India. After their student period, staff nurses are paid very little money. In a state like Kerala, from where 75% of nurses in this country, for India alone, 75% of nurses are produced by this little state called Kerala. There are only a few others that are from the other parts of the country. However, this part of the country pays almost the least salary to their nurses.
Ms. Rosalie Notwell. Ms. Rosalie is an undergraduate nursing coordinator at St. John of God Hospital in Perth, Western Australia. She has a 25-year background in clinical nursing education and is a registered nurse of 36 years across Australia, New Zealand and the United Kingdom.
Good afternoon, ladies and gentlemen, and thank you so much for the privilege and opportunity to present here at the Healthcare Seminar. And a very special thank you to IHNA for your generosity and hospitality that you've shown us throughout our stay. You've all just been wonderful, so thank you. I work for St. John of God Healthcare in a 650-bed private Catholic hospital in Perth, Western Australia, where we currently have over 700 student placements annually from 10 education institutions. St. John of God Healthcare is an organisation which has 17 hospitals across Australia and New Zealand. I'm just going to begin with a historical overview of nursing education. Prior to the transfer of nursing education to the university sector, nurses were trained over a 3-year period entirely within the hospital setting and rewarded with a certificate in general nursing. In the late 1970s and early 1980s, nursing education was transferred into the university sector. By the early 1990s, hospital-based schools ceased to operate and universities finally granted bachelor degrees in nursing. Oh, hang on, something's going wrong here. Sorry. Australian Nursing and Midwifery Council. The Australian Nursing and Midwifery Council, ANMAC, is a peak national nursing and midwifery organisation established in 1992 with the purpose of developing a national approach to nursing and midwifery regulation. The ANMC works in conjunction with the state and territory nursing and midwifery regulatory authorities to produce national standards. The National Competency Standards for a registered nurse are the core competency standards by which their performance is assessed to obtain and retain their licence to practice as a registered nurse in Australia. These core competency standards provide the framework for assessing competence, to assess nurses educated overseas seeking work in Australia, to assess nurses returning to work after breaks in service, and to assess nurses involved in professional conduct matters. Universities also use the standards when developing nursing curricula and to assess students and new graduates' performance. AHPRA, which was touched on earlier, AHPRA's operations are governed by the Health Practitioner Regulation National Law and came into effect on the 1st of July 2010. This law means that for the first time in Australia, 14 health professions are regulated by nationally consistent legislation under the National Registration and Accreditation Scheme. AHPRA supports the 14 national boards that are responsible for regulating the health professions. The primary role of the national boards is to protect the public, and they set the standards and policies that all registered health practitioners must meet. The types and categories of nursing in Australia. We'll begin with a nurse practitioner. A nurse practitioner is a registered nurse is taken out at the technical and further education institutions for an 18-month period. And in stage 1, they cover infection control, Indigenous and cultural studies, the nursing profession, the Australia healthcare system, legal and ethical principles of nursing practice, effective communication in nursing practice, physical health assessments, first aid, and the implementation and monitoring of nursing care of patients with chronic health problems. And the first semester, they normally do a practicum in an aged care facility. In stage 2, they study the analysis of health information, client assessment, development and implementation and evaluation of nursing care plans, wound care management, medication administration, reflective practice, critical thinking and analysis, and oral health. And in the second semester, they usually attend a surgical practicum. In stage 3, they continue with medication administration, mental health nursing, acute health nursing care, complex nursing care, geriatric and palliative nursing care. And in stage 3, they normally visit a surgical area and a mental health area. Simulation in nursing education, which is increasing considerably in Australia. Human patient simulation is a relatively new teaching strategy that allows learners to develop, refine and apply knowledge and skills in a realistic clinical situation as they participate in interactive learning experiences designed to meet their educational needs. Learners participate in simulated patient case scenarios within a specific clinical environment, gaining experience, learning and refining skills, and developing competencies.
Mr. Jomit Mani, Clinical Placement Coordinator. He has done his Master of Social Work from India and worked as mental health social worker in different hospital and rehabilitation settings in India. Has worked in different disability support centers and currently working with IHNA as Clinical Placement Coordinator.
I would like to express our sense of obligation to Dr. Padma Kumar, Chief Medical Director, Sunrise Hospital, for inaugurating this seminar. At outset, I would like to express my profound gratitude to our Chief Guest, Annie Samantha, Regional Director, Education, State Government of Victoria, Australia, for sparing her valuable time to address the gathering and launching professional development courses of IHM. On behalf of IHNA and IHM, I extended my deep sense of appreciation to all speakers, delegates from India as well as overseas, distinguished participants and land guests for participating in the event.